So we know that if you have neuropsychiatric symptoms in general, if you have prominent neuropsychiatric symptoms at an early phase of the neurodegenerative disorder, that your prognosis is probably worse. We also know that based on studies that have been done referencing the construct of mild behavioral impairment, that you can have neuropsychiatric symptoms in the absence of cognitive impairment. And that can be an early warning sign, again, that you're going to go on to develop some form of neurodegeneration. And the availability of biomarkers has really made that point very, very clear to us, that you can have these symptoms before the onset of any sort of neurodegenerative process, and that it can predate the process. The other thing we know is that as the dementia progresses, the prevalence of neuropsychiatric symptoms rises, and specific forms of symptoms like psychosis tend to be more prevalent in the latter stages than in the earlier stages. So if you look at MCI, mild cognitive impairment, there's a fair burden of neuropsychiatric symptoms, but symptoms like psychosis, there's only about 3% of patients that have psychosis. As you progress in the cognitive trajectory, you tend to see these symptoms more and more.